Hello, my name is Vaskin Dilsizian. I'm from University of Maryland Medical Center and Associate Editor of JACC Imaging. With me is Dr. Albert Sinoussis from Yale University School of Medicine. Dr. Sinoussis, in the current issue of JACC Imaging, you have written an editorial comment that will be accompanying Dr. Lynn Johnson's and co-workers' paper, where they test the hypothesis that therapeutic angiogenesis in the heart can be imaged in vivo using SPECT radio-labeled peptides that target integrin. Could you first summarize what the paper showed, and perhaps we can discuss the application of this animal study in human models subsequently?
Sure, I'd be happy to. So Dr. Johnson and her colleagues have employed an established pig model of hibernating myocardium, which makes use of an amyloid occlusion, which creates a graded progressive ischemia and results in an angiogenic response. After 3 weeks of establishing the ischemia and the hibernation, they randomized the animals to treatment with either a viral vector to turn on VEGF or a saline control. And 3 weeks after treatment, they injected the animals with a target RGD peptide that binds to the alpha V beta 3 integrin in order to mark non-invasively the angiogenic response.
That's great. As you know, we have read with quite interest in the late 1990s, where all these positive results were coming out using phase 1 open-labeled trials in human studies, where they looked at the myocardial ischemia models as well as peripheral vascular disease model, and in these cases they were using therapeutic angiogenesis, and the results were quite promising. Unfortunately, as you know, the phase 2 randomized double-blind placebo-controlled trials were non-confirmatory, sometimes conflicting results appeared. And I was wondering if you feel that the results were not duplicated in the phase 2 trial because of poor targeted imaging, or was the therapy itself was the problem?
Well, I think it may be a combination of factors. I think it may be that effective angiogenesis requires the administration of multiple growth factors instead of a single growth factor. But also, I think importantly, it may have been that the imaging tools that were used to evaluate these therapies were insensitive enough. Traditionally, we focus on looking at the physiological consequences of angiogenesis, looking at changes in perfusion or changes in function. And what we really need is a more sensitive, molecularly targeted approach that would let us look directly at the molecular signals that occur with the angiogenesis.
So what you're saying is that although we may be targeting budding angiogenesis and visualizing it with the current study, what we have done is we've looked at the functional consequence of these neovascularization, if you will, by looking at perfusion metabolism. And one could argue perhaps it's the latter that's more important than the actually looking at the vessels. How would you respond to that?
I think that is true, that to have perhaps a clinical impact, you want to have changes in the physiologic events. You want to see an improvement in perfusion, you want to see an improvement in mechanical function. However, in the evaluation of novel new therapies, you need to have sensitive imaging tools to detect sort of the beginning of a potential therapeutic effect, because it may be an issue of timing as well as sort of the imaging parameters that were evaluated. So I think you really need to look at both parameters. You need to look at the molecular events in combination with the physiological consequences.
Great. And is this signal that's been shown in swine model translatable to human imaging?
Yes, I think people have used the alpha V beta 3 integrin to look at unstable plaque, which is a difficult target to translate into patients. However, evaluation of angiogenesis in the myocardium is a reasonable target that I think can be accomplished in patients.
Great. It's been a pleasure discussing this topic with you, Dr. Sinoussis. It sounds like there's many new opportunities in targeted imaging, and we look forward to having you participate in this forum again another time. Thank you.
Have a question or comment about a CVN story? Send us an email at cvnfeedback@acc.org.